Okay, okay. Um, Ibipa de Bowe Fongo. I'm from Nigeria, and I'm part of this cohort 15 of this course. I'm presenting a debate topic on should gene therapy be the first line of treatment for childhood leukemia. Now, the question is, what is actually leukemia? Leukemia is a cancer of the blood and the bone marrow characterized by uncontrolled production of abnormal white blood cells. It originates in the hematopoietic stem cells of the bone marrow where blood cells are normally produced. Now we are talking about childhood leukemia. It's one of the most common pediatric cancer affecting the blood forming cells in the bone marrow, like I said earlier. And this tends to cause overproduction of the white blood cells, but they are immature to carry out the function, whereby it stops the and the quantity of every other blood cells in the human body, and like we know, is a malignant cancer. Now, traditionally, treatment are based on chemotherapy, radiation, stem cell transplant. Challenges include high toxicity, relapse risks, long-term complication. Now we are talking about gene therapy. Gene therapy offers a targeted treatment with potential higher survival and reduce side effect. If talking about gene therapy, it has to do with modifying the gene of the white blood cells of the individual that is being affected, that it should be able to see those cancerous cells and destroy them. Now, leukemia in children begins with DNA mutation in blood forming cells. That is the abnormality, whereby there's a mutation, that is a change in the DNA of these blood forming cells, which now instigates them producing in the numbers they do produce that tend to affect the human body system. Conventional treatment attack healthy cells along with cancer cells. That is, in the case of chemotherapy and the rest, we have seen cases whereby these treatment, that is in chemotherapy, it also affect the cells, the abnormal cells, and also the healthy cells. But likely that is not the case of gene therapy. Gene therapy, especially CAR T cell therapy, is reprogram a child immune system to target leukemia cell. Like I said earlier, it is being programmed, like the gene of the individual white blood cell is being modified to be specific in targeting those cancerous cells. Potential benefits, which include precise targeting and reduced toxicity and higher remission rate. That is for gene therapy. Now, one of the points I believe why gene therapy should actually be the first line of treatment is that precision in medicine. The target the target specific antigen like CD19 on leukemia cell minimize damage to healthy tissues and reduce long-term toxicity. Like I said earlier, it is precise. It is not like a generalized kind of therapy. It is being precise. It identifies the CD19 leukemia cells, that is the antigens and the surface of that cell, and it attack it specifically. Higher remission rate. CAR T therapy shows more than 80% remission in relapse in in childhood leukemia. Early use could prevent resistance and relapses. That is, if it is being used as the first line of treatment, it has the chances of reducing relapses and the rest. Reduces long-term complication. Chemotherapy linked to cardiotoxicity, infertility, secondary cancer. Gene therapy may reduce these risks. We've seen people that have undergone chemotherapy and the rest. You see secondary cancer recurring. You see cardiotoxicity, and there are a lot of other complications that comes as a result of subjecting the patient through chemotherapy procedures. Ethical responsibility. Children deserve access to safest and most effective therapy. So I think we'll be talking about like the rebuttal. Now, most persons will come and tell you that chemotherapy is effective and all of that, but we're talking about effectiveness based on the trials that have gone on and people that have been able to be beneficiary to all of these. It makes you understand that it is more effective than chemotherapy when it comes to its specificity of carrying out this gene therapy. Works in relapse refractory cases and logic favor first line of treatment. So for this purpose, it is more effective than chemotherapy based on the information at hand because of its specificity of identifying the leukemic cells. Limited data, long-term chemo outcome shows severe complication. Gene therapy aims to prevent them. Now, we've seen, like I said earlier, cases of cardiotoxicity and the rest of it that has been associated with chemotherapy and a lot of other complications. But in the aspect of gene therapy, it aims to prevent such situation because of its specificity of knowing where its treatment is being taken to, what is being identifying, what is being handling. Safe consign, safe effects, I mean side effects like cytokine release syndrome are manageable in the case of in the case of gene therapy. Gene therapy may reduce overall long-term costs compared to repeated chemo and hospitalization. Now, people will tell you that there are literatures. I would say gene therapy is more expensive, but if you look at the amount you take for each chemo section, and for a period of time you are subjected to this chemo section, you see that it is even more expensive than subjecting a patient to just gene therapy for one time or so that is being required. So, like closing statement, gene therapy targets the root genetic cause of leukemia. Other offers higher remission, precision, and potential for a full lifetime. Children deserve treatment that allow them to survive and thrive. Ethics, science, and compassion support first line use. So I will end with these few points of mine that for gene therapy, it should be considered as the first line of treatment based on the fact that it is precise and it offers a more reduced complication at the case of chemotherapy, where we see in cardiotoxicity and the rest of it, and secondary cancer that may reemerge even after utilization of chemotherapy. So, with this point of mine, I just want to close this debate with that. Thank you very much.